Hello everyone and welcome to SHP Insight. Our guest today is Norman Bolus, who officially retired April 30th after serving UAB since 1984. He did it all, working as a technologist, lab instructor, teacher, clinical coordinator, and most recently, director of both our Nuclear Medicine Technology program and our Health Physics program. In terms of leadership beyond UAB, Norm has served in all areas, local, regional, and national, and worked at all levels, including president of his national professional organization. And he's won honors at all levels, including the Marshall Brucer Award, the highest honor given by the Southeastern chapter of the Society of Nuclear Medicine and Molecular Imaging. Norman, it's a pleasure to have you join me here today. Let's begin with the typical nuclear medicine student. Who excels in nuclear medicine?
Well, that's a really great question because over the years I've seen a variety of students come and go, and it really is the student that is empathetic and is interested in healthcare providing that really takes the patient to heart that I've seen excel. Our field, we make a difference in patients' lives by what we do and determining different disease states and even treatment now in nuclear medicine.
Your program, NMT, was the first entry-level master's in the United States. Recently, you added tracks. Can you tell me a little bit about the tracks?
Yes, those tracks are pending currently. We're going to get Board of Trustee approval on those. We're expected in June of 2021. It's a matter of what I'm calling Nuclear Medicine Plus. The students will have nuclear medicine as their base, but then we've added tracks in 3 different areas. One, an imaging specialist, which provides them with everything they need to be dual certified in both nuclear medicine and computed tomography. In addition, we have a secondary track that they can choose to decide in radiation safety officer training. And so we're actually plugging in more of our courses with our health physics program in that track, and they will get everything that they need, that they will be able to sit for the board exam in nuclear medicine that actually allows them to get RSO certification through the Nuclear Regulatory Commission. Our third track is for those that really want to go on and get a PhD, and they want to do research. And so they're going to switch over to a Plan 1 thesis option. That last term, they're going to do all research. And so they'll still get their nuclear medicine and be able to sit for the nuclear medicine boards, but then they'll also have that research component if they choose that track.
Well, again, the NMT program is at the vanguard of research, at the vanguard of clinical care, and thanks a lot for leading that. One of the wonderful things about being at UAB is having access to everything at UAB, the healthcare system, the hospital. What are some of the highlights?
Our students are so fortunate. Down at the hospital, they have started an advanced imaging center, which includes a cyclotron. And that cyclotron, when it was put in, was actually the most powerful one in the United States for research. UAB and that Advanced Imaging Center and cyclotron is really becoming quite known nationally and internationally as a provider of these very highly specialized radionuclides. Our students are able to tap right into that, and it has been just an incredible asset to be able to have that available for our students. And I'm so happy that we have 2 of our graduates working in that area, and actually we have graduates working at all facilities in the state of Alabama, being the only program in the state. And it's just a joy to see them be able to flourish in our field and know that those graduates are helping the citizens of Alabama.
Yeah, that's fascinating. You've mentioned, and we've talked a little bit about proton therapy, you've mentioned MR PET, and we're very unique in those. Are there any other, what are the next big developments for nuclear medicine?
Really, personalized medicine, we're playing right into that in nuclear medicine. And how we're doing that is through this new realm that's developing called Theranostics. And what we're able to do is we're able to take a drug that has been manufactured to target particular markers of a tumor, and we can actually individualize that to the person's own tumor cells. And we can put a radionuclide on it, and we can make sure that it's going to that tumor, and we can see it. And then we can substitute a more potent radionuclide onto that same drug, and it will actually kill the cancer cells. And so there's actually some debates going on right now between nuclear medicine and oncology and other physicians as to, well, who's going to lead this charge with this new developments that are coming. And it's really exciting that we're a player in all of that. This area is really growing in nuclear medicine, and there's really no end to where it can go.
Well, you've had such a tremendous impact on the educational lives of all of our students, all of the clinical people that you know and you've worked with over the years. Your research has been published in multitudes of journals. You've been here over 30 years. You did your degrees here. It's really hard to sum this all up, but what has UAB meant to you?
I remember taking a tour of the campus and actually walking through Volker Hall and all the research labs in the basement, and they were working on things. And it was like, wow, I didn't realize UAB was into all of this. Research takes a long time, and it took about 20 years for UAB to have the fruits of the labor of that research that I saw even in 1984 to be recognized. Just to have seen the growth of this campus in areas of research, in physical facilities. People say that we're the University that Ate Birmingham, and I've actually seen that over the last 37-something years.
Well, Norm, I love to use the word kindness, and you are the most kind gentleman, one of the most kind gentlemen that I've ever met. I thank you for your dedication to UAB. I thank you for your dedication to nuclear medicine, and I am so, so glad to have had this time to talk to you today. Thanks, Norm.
Well, thank you.
Turning now to SHP News. Congratulations to Real Herald and our Department of Health Services Administration for receiving the 2021 President's Award for Excellence in Support of UAB and Shared Governance. She is the immediate past chair of the UAB Faculty Senate, and throughout the pandemic has exemplified the UAB core values of integrity, collaboration, and excellence. Our Physician Assistant Studies program has been awarded a 5-year HRSA grant for nearly $1.5 million. Wei Li is the principal investigator, and Tosi Guilford is co-investigator. The grant will help the program develop and sustain PA students in the areas of addiction medicine and mental health. It will also be used to increase student diversity and expand current programs for veterans and underrepresented minorities. And lastly, Amy Goss in our Department of Nutrition Sciences has received a $3 million R01 grant to implement a family-based diet intervention to treat fatty liver disease and obesity in adolescents. The grant funded by the NIH will help fund a randomized controlled trial to examine diet effects on changes in hepatic lipid content. You can see the details of her story and more at go.uab.edu/SHP News. That's all the time I have for now. Thanks so much for watching, and go Blazers!